Welcome to another episode of Shared Experiences in Oncology and Rare Diseases. I'm your host, Erin Moriarty Wade. I'm a communications and patient advocacy manager at myTomorrows, and I'm also the mom of a child with a rare disease. Today, it's our pleasure to welcome a very special guest to the podcast, Dr. Danny Sands. Dr. Sands has worked at the intersection of healthcare, technology, and business for more than 20 years, and he still continues to see patients at Beth Israel Deaconess Medical Center in Boston. Dr. Sands also holds an academic appointment at Harvard Medical School. The main reason we want to speak with him today is that he is the co-founder of the Society for Participatory Medicine. Dr. Sands, thank you so much for being with us today.
Nice to be here, Erin.
Thank you. So to get started, I'd like to ask you if you could first explain the concept of participatory medicine to our listeners who may not be familiar with it.
Sure. So the Society for Participatory Medicine was created in 2009 by a group of healthcare professionals, patients, caregivers, and we wanted to really start a movement to transform the culture of patient care. We recognize that technology has a potentially huge impact on how patients connect to their healthcare, connect to their healthcare professionals, to caregivers, to other patients, to information, and so on. So the 12 or so of us who got together to do this, we envision a time when patients, caregivers, and healthcare professionals fully participate in a collaborative journey to better physical, emotional, and social health. That's kind of in a nutshell what it's about.
Okay, that is a very tall order and a big challenge, I'm sure.
Yes.
Not an easy one to tackle, but it's amazing what you all have done so far in that time since you founded the society. Can you tell us a little bit about kind of how it's grown and how it's evolved? I don't really know much about the history there, but I was very happy to become a member in 2018, so I'm relatively new to the movement. But tell us a little bit about kind of how it's grown.
Yeah, when we started, the group of us who got together, as I said, we're people who are all different backgrounds, and we all had this vision that we more or less shared, despite our different perspectives. And one of the things we recognized at the very beginning is that healthcare is very resistant to change. As I know you know, Erin, it's very hard to get healthcare to change. And although we were all despite our roles, we were all patient advocates. We recognized that healthcare wasn't going to change just because it's being pushed by the outside by a bunch of uppity patients who are upset about the way things are going. So we really wanted, we certainly want patients to participate. We always wanted that participation, but we really wanted insiders too. So we wanted the organization to include members who were stakeholders from across the healthcare spectrum, patients, caregivers, doctors, nurses, other clinicians, researchers, healthcare executives, and so on. Because when we bring people together with these different diverse perspectives, we can discuss the challenges and the opportunities, and we can figure out how to make an impact and how to change the world. From the very beginning, one of the things we did is and actually before we started the organization, we created a blog known as the ePatients blog, now the SPM blog. And that's been a very exciting place. We've had a lot of interesting dialogue there. But in addition, right at the time of the founding, we created a journal, a peer-reviewed journal called the Journal of Participatory Medicine.
Awesome. Okay, you guys have done a lot. You've been busy, and this is not anyone's full-time job. I think you all have day jobs as well, or multiple
yeah, that's part
day
of
jobs.
the challenge. That's part of the challenge, and we have done a lot. We've always punched above our weight class. We actually, so you asked how the organization has grown. Well, we've grown. We've done a lot of different things. We've impacted public policy, which is one of the ways we do things. We've done a number of conferences to talk about the challenges, the opportunities, share stories, and so on. And our journal is now indexed on Medline, which is really important. And yes, there's a lot to do. We are all volunteers, except that during COVID, we actually hired our first executive director. So we have an executive director now, which is really great. And we're really on a growth trajectory right now.
Excellent. And what was it you mentioned about public policy? What kind of effort was that, or what did that involve?
Well, when you think about participatory medicine, which we can talk more about what that is, but we want to make laws and regulations that really support it. So I think a lot of our efforts have been on patient access to health records, for example. That has been a big thing that we participated in pushing. And of course, you know now that all patients do have access to their health information. And so the various policies related to that, that's stuff that we weighed in on, and we were told that they appreciated our feedback given our unique perspective. So that's an example of the kind of things that we've been pushing on.
Okay. That's a good example that I can personally relate to, because I once waited 11 months for some medical records to come from Atlanta, and then they arrived via express mail. And I couldn't even remember what it was. I took it out of the mailbox. I'm like, wonder what this is. And I had since obviously back channeled and gotten them through the physicians because we needed it for our daughter. But it blew my mind that it was almost 11 months to the date, and it was express mail. So this was quite a few years ago, but I appreciate your efforts on that.
Yeah, it's huge. And, we hear stories of patients who, like Regina Holliday, for example, who's one of our members. She was trying to get records from the hospital so that she could transfer her husband to another hospital, and they just dragged their feet, wouldn't give the records, wanted to charge usurious fees, and by the time she was able to get them, it was too late. And those kind of stories I hear all the time, and they're just heartbreaking.
Yeah, that's horrible. Yeah, there's definitely a lot of work to be done, but it's great that you all are pushing in the right direction and things are happening. One of the things I wanted to ask you a little bit about, you touched on kind of the idea that, healthcare is just by nature resistant to change, and that you really have to kind of focus on transforming the culture and not just pushing from the outside and saying, you need to do this and pointing fingers, but really making it, kind of a more organic movement from inside healthcare. How do you tackle that? Because that sounds difficult.
Well, yeah, it's not easy. And we focused on sort of 4 areas. One is to have conversation and build community across the healthcare spectrum, as we were talking about. Another is to do advocacy and push public policy. Another is to promote research in this area. And the third is to educate people. And we need to educate everybody in this space. It's not just about those damn doctors, and of course I am a doctor, those darn doctors who just don't really care. And it's really about educating both sides. I like to think it's sort of it's a reimagining of healthcare. I think I may have shared this with you when we spoke before, but I think that both healthcare professionals and patients implicitly think about healthcare as if it were a car wash, where the patients are the car and they're unhealthy or dirty. And the healthcare car wash is there, and they go to that healthcare car wash and they're cruising passively through this healthcare car wash, getting health sprinkled on them and somehow coming out the other side healthy. But that's not the way healthcare should be. By doing that, we have an expensive system that's not tailored, it's not satisfying, it's not what we really want. What we want healthcare to not be that car wash that I think we implicitly act like it is, but we want healthcare to be thought of more as a collaboration between the healthcare professional and the patient, where the topic of that collaboration is the patient's health. And if you think about collaborations in any aspect of your life, you need to make sure that you have open communications and sharing of information and sharing of decision makings, mutual respect and engagement, and mutual trust and respect, I should say. And all these things are really important in any healthy collaboration. And I think if we think about applying these to healthcare, think about your relationship with your healthcare professional. Are you both bringing those things to the table? Now, in participatory medicine, and I don't know if you were at our 2019 conference, but we did an exercise there where we tried to distill down what are the principles of participatory medicine. And it was a very energetic exercise. Some might say chaotic, but at the end we had lots, maybe 1,500 different Post-it notes with different ideas about this, and they were categorized and
That must
Yeah,
have been fun.
it depends on your perspective, Erin, because if you're someone who likes those kind of activities that are a little bit frenetic,
Yeah, yeah.
it's totally fun. If you're
Yeah,
someone who
yeah.
likes a little more structure in your life, it was just chaos. But the point is that
I
I mean
like
they
that
worked.
chaos. I can roll with
Yeah.
that.
So so the idea is that we wanted to come up with a set of principles and how those would be reflected depending on what your role is in the healthcare system. So although there was a lot that came out, it was hard to know what came out of that. We actually had a group of people, God love them, who went through all of the notes and post-it notes
Oh,
and
wow.
charts and stuff, and came up with this, distilled this into a series of five ideas, and the manifestation of those ideas, depending on what your role is in healthcare. And those five ideas we now call the Participatory Medicine Manifesto. And they are: share and listen, respect one another, share information responsibly, promote curiosity, and be a team builder. And so those principles are the important things. And we want people to pledge to that, whether they're a healthcare professional or a healthcare organization or a patient or a caregiver. So the way this works, if you look at the manifesto, is that if you look at, for example, respect one another, on the healthcare professional side, you're pledging to respect patient perspectives based on culture, upbringing, and circumstances. It's encouraging my patients to be honest by being respectful and non-judgmental. On the flip side, for respect, if as a patient or caregiver, I will take the time to make sure I understand what my healthcare professionals are telling me and respect my loved ones' wishes about sharing information, gathering research. So that's what's built out in the manifesto. And one of the things that we're doing as an organization, 2022, 2023, so this year and next, is we're doing a series of events that we call creative learning exchanges that are half-day, intensive, energetic events where we have lots of audience engagement. We're not having just a sage on the stage. We might kick it off with one presentation, and then this should be followed by reactors and breakouts and panels and so on. And at the end, we want to come out with something concrete. Maybe it's a set of ideas, maybe it's a toolkit, or it's a white paper or whatever. And so we want to do these, and all these events, I should say, are these creative learning exchanges are riffs on the manifesto. So it might be blowing up one of the balloons in the manifesto about, say, respect, or it might be an overview of the manifesto and how you apply it to a specific population. For example, we're doing an event in an underserved area of Boston, where we're going to be focusing on how the manifesto applies in an underserved population, picking up issues of health equity, power imbalance, and so on. So that's one example. Another example is an event we're going to be doing on the West Coast in 2023, which is focused on how the manifesto applies for end-of-life care decision-making.
Oh, wow. That's a big
and those are some examples of the things that we're going to be doing.
Wow, that's great. Those both sound really interesting. And certainly nice to get feedback and get more discussion going about the main points from the manifesto. That's excellent. Let's see, what did I want to ask you about with when is the event in the Boston one and then the West Coast? Have they been decided yet or not quite?
Yeah, the Boston event is going to be on October 20th. Okay. And you can check our websites for updates. It's going to be at the Whittier Street Health Center in Roxbury. The West Coast event at End of Life Care is to be determined. I think it's going to be in late April, and we don't have the site for that yet. But we have another West Coast event in the Northwest that's going to be in Portland, Oregon, and I believe the date is December 1st. In collaboration with Oregon Health and Sciences University, as well as HealthSpark.
Oh, great. Okay. Excellent. I'll keep an eye out for those, and some of our listeners may want to learn more about those as well.
And if any of your listeners are potentially interested in this as an organization, as a company, please get in touch with me, because we're always looking for sponsors and co-creators and so on.
Okay, great. Well, we'll put that in the description with the video, and then a link for how to reach out to the society or to you for people as well. So
thanks, Erin.
That's great. I wanted to ask you, we talked a lot about kind of the struggle with communication and sort of the need to have shared decision making between the physician and the patient. Um, because of my personal experience, I hear a lot and I see a lot from the patient and caregiver perspective. But I want to ask you, as a practicing physician, what are some of the pain points that physicians face, and in the setting of practicing medicine and trying to really uphold these values and ideas that are in the manifesto, but also facing the day-to-day crush of patients and workload and that kind of thing.
Yeah, I think that there are a number of challenges that are present in practicing this way. I think the biggest challenge, honestly, is fee-for-service healthcare. So for those who aren't on top of this and think about these things all the time, there are different ways to get paid for healthcare services. The way that is most common today is fee-for-service, meaning that you're basically paid for piecework. You're paid for your visits and how many procedures you do and so on. And that puts an incredible time pressure on physicians. And in order to, basically stay in business, you have very short visits because the reimbursement is so low. So I think that's a big challenge, is that you're just so time compressed, and it's really challenging to do this. And, I think that patients need to understand this limitation when they're coming to the office. Oh, why won't my doctor read all these papers right away and get back to me that I'm, all the stuff that I'm bringing to her. Why aren't they doing that? They don't understand. They may not understand what the pressures are there, the time pressures. I think another problem is a problem with, in general, health literacy and numeracy among the population, which is just that, people aren't learning these things in school. We don't have enough teaching in math and statistics and science and things. And so that was a problem before. And now we have this additional problem, which is that there's this lack of respect for truth and what is knowledge, what is an expert. And that's really a challenge as well. I'm not saying that I have to be held up to be the expert on everything in medicine, but I think there is medical science. There are documented facts that we need to both respect. And I think that, for some reason, the idea of expertise has become politicized in this country. And that has been a big problem. And I think, I kind of think that is, I'm not going to talk politics on your podcast, but I think that one of the things that comes from is a lack of understanding about the scientific process, understanding of statistics and critical analysis and so on. But I think that these are some of the problems that happen in the office. And I think another problem is one where we have underserved populations. We have people who are in minorities, who feel uncomfortable stepping up and challenging their physicians and asking the tough questions. And I think that's a terrible problem. And that's one of the things that we're trying to work on in some of our work. For example, when we're doing this creative learning exchange in October, we also are proposing to do a set of video interventions in some underserved communities. I think we need to teach everybody how to step up and how to be engaged, bring their A game to their doctor's appointments. And we clinicians need to do that as well. But we both need to be doing that. It's just a harder thing to teach it when there's already distrust of the healthcare system, which is deeply ingrained. So those are just some other barriers we have to deal with. And sometimes that means we have to pull patients out a little bit more. We have to really wait. We can't just fire information at them, expect them to come back right away. We need to really draw them out. And that, requires a special set of skills as well. Mm-hmm. So I don't think these are insurmountable, but I think we have to recognize the fact that there are challenges, as you point out, and it's not easy. But I think the other thing to recognize, Erin, is on the plus side of this, that more physicians are burned out today than ever before. We have the highest rate of physician suicide we've ever had. And those are scary statistics. And I argue that if we embrace these principles, so rather than feeling, as some healthcare professionals do, oh, great, now we got to worry about these patients pushing on us. And on top of all the other things I got to worry about, it's just an added source of stress. But I think, on the other hand, if you embrace this and you think about healthcare as a collaboration, I feel very strongly that it increases the joy of practice. And it is one of the antidotes for burnout in healthcare.
That's an interesting point. Yeah, I hadn't thought about it like that, but that does make sense. Well, it's interesting because in the work that we do at myTomorrows, we have heard a lot of the same points that you just brought up. And there are a couple things that we're doing that really kind of address those challenges. The first being that we have all of our services are free for patients and physicians. And one of the main services that we offer for patients is a patient navigator. So we have navigators who have a medical background. Some of them are physicians, some are nurses, have different medical experiences, but they speak 10 different languages, and they can get on the phone or get on a video call with a patient and explain things in layman's terms, but in a medically accurate way. So if a patient wants to search for clinical trials and learn about these options, they can have somebody walk them through the process, explain it to them on their own time, so that then when they go to have a conversation with their doctor, it's not, starting from scratch. And then for the physician side of things, what we provide is if a patient comes to us and says, or a caregiver, based on the patient's medical record, we provide them with what's called a treatment search report. And so it's a listing of all possible clinical trials based on like searching databases like clinicaltrials.gov and UJCT in Europe. And it's medical information that the patient can bring to their physician, and the physician can see, okay, this is, the description of how the drug works and what the eligibility criteria are. So it's a nice way to kind of facilitate shared decision-making between the patient and the physician. And it kind of empowers the patient to have something in their hands that's not, a random article that they printed out from the internet, but that's actual medical information that they can discuss. So we do feel very strongly about that. And it's been nice because in my job, I've interviewed both physicians and patients who have, been on either side of this experience and kind of, heard how it does address some of those pain points. So we feel your pain, and we are working in the same direction. So just wanted to let you know that.
That's a terrific model, Erin. I really do like that.
Yeah, it's been great. So, and I guess from the physician perspective and also from the society's perspective, what can you recommend that patients can do to do their part? I mean, obviously, the society is doing everything that you can, and physicians are doing what they can. What can patients do to facilitate a better conversation and relationship and shared decision-making?
Yeah, I think that there's several things. So one is, if you have a serious disease or a chronic disease, learn as much as you can about it, read about it. And try to read mainstream things to start with. Don't read those far out things that may not really be, they're kind of fringe. Because I think that as physicians, we're going to be a little bit guarded about that because we need to be conservative. We need to be careful about what we do. It doesn't mean you can't look for clinical trials. That's not what I'm talking about at all. But if you're looking at a fringe website that says, oh, all you have to do is coat yourself in feathers and say a prayer and you're going to get better. I mean, look. Yes,
I have heard it all, because the minute I tell someone my child has a rare autoimmune disease, that just the word autoimmune makes people come up with like every, crazy,
that's right.
I can tell you like seaweed, honey, there's been, so I hear you.
So that's, so learn about your condition. So that's number one. And if you can find, if you have a serious condition, it's sometimes a good idea to find a well-established online patient community because you can learn a lot from other patients who have been through this and done well. Sure, you can find fringe ideas there as well, but in a well-established, mature community, fringe ideas are usually shoved to the side. There's sort of this self-correction that takes place in these communities. I also think that it's important if you have, it's important for everybody, but especially if you have a serious condition, try to learn a little bit about the medical literature. Try to learn about, statistics, just basic things, and see if you can find a coach or a mentor who can help you understand the things that you're reading. So read about your conditions, and then you have a limited amount of time with your physician, right? And so you want to use that effectively. So come prepared. Come prepared for your visit. These are a set of questions I want to ask. This is the agenda I want to do. I encourage my patients to share that with me ahead of time so that we can actually collaboratively develop an agenda, because you've got to recognize that your physician is also going to have an agenda for the visit. And again, you have a limited amount of time. So if you can negotiate that ahead of time, you can probably use that time most effectively. And recognize, I think the other thing patients can do is try to understand a little bit about the healthcare system. Understand, how your physician gets paid or how they fill their day or whatever, because there are a lot of misconceptions out there. And I'm not saying that, the problem in healthcare is that the patients aren't empathizing with physicians enough. I don't want you to get that idea. But I think that in any good relationship, there's a mutual understanding. So I need, we talk a lot. A lot has been written about seeing healthcare through the patient's eyes. Yeah, darn important. But I think understanding the other way around too is going to be helpful, because it might give you insights. You say, oh yeah, maybe I shouldn't be sending that portal message to my physician every day or 3 times a day. Or so on, or maybe it's not realistic to expect my physician to read the stack of articles that I just brought them right away. Because remember, it's not that I don't want to read that stack of articles, but all that is unreimbursed time. And I have, all of us have only so many hours in the day, right? And I have a lot of patients, and many of them are bringing articles, and I need to know a lot about a lot of them. But you're the patient, you should be well versed on all of this. So limited amount of time is really important to understand. As my mother taught me a Yiddish expression that says, it has to do with time limitations, which is that, and I won't say it in Yiddish because I'm not good at that, but it's
you can do both.
you can't dance at 2 weddings with 1 tuchus.
Oh, that's good.
So I can only do so much. So I think but just like earlier, I talked about drawing out patients who may be reticent to, engage with their physicians and participate in shared decision making. Sometimes that has to go the other way around too. And when you look at the way we've done things with the society, it's all about mutuality. So it's about the physician and the patient pushing the physician to get more engaged. Yes. But it's the other way around too. Sometimes the patient has to draw out the physicians a little bit and come out and say, what I really want to do is I want to be a partner with you. I want to work together with you to improve my health. And that's music to my ears. And I think many physicians would like that approach rather than, I'm sick, doctor, make me well.
Send me through the car wash.
Right, exactly.
Yeah, those are really all excellent points. And I think really good advice for patients and caregivers. And I fully understand what you're saying about the time constraints and, not just the reimbursements, but the broader picture of, life balance. I always think back to a couple of years ago, I was on a call with a group of physicians for this. I'm involved in a work group, a patient and physician work group for CARA. It's a Childhood Arthritis and Rheumatology Research Alliance. And so, we meet at least once a month, and this call had run way late. It was going on 6:30 at night on like a Tuesday or something. And it was about a week or so before Christmas, and everybody's busy, but we were focused and we kept going. And then finally this one physician was like, guys, I'm so sorry, but we've gone 30 minutes over, and I promised my kids we'd go get our Christmas tree tonight. And my husband leaves for his overnight shift in the ER at whatever. So I've got to go. And I'm like thinking, oh my gosh, this woman is sitting here on this call, like beyond, above and beyond after hours to try to help my kid who has a rare disease. Meanwhile, her kids are home waiting for her to come get the Christmas tree. So I hear you and I understand that. And we've also, interviewed physicians who've talked about how like, I don't have time to run to the bathroom. I don't have time to eat. Like these are
Yeah.
basic human needs that are realities in practicing medicine. So thank you for reminding everybody about those pain points for sure. Excellent. Well, I think that was kind of the end of our questions. Is there anything else about the society or anything that you wanted to share? Anything else you want to mention?
Just that I would love to see all of you get engaged in the society. Anyone who's listening, and Erin's going to give you information about that in the show notes. We get things done because people roll up their sleeves and they say, yeah, I want to get this stuff done. We're doing a lot of interesting things. We need a lot of people to participate in it. I'd love to hear from you. I'd love to see you publish. If you're writing opinion pieces or you're doing research, I'd love to see you submit those to the Journal of Participatory Medicine. And I'd love to meet you at at our creative learning exchanges that are going to be taking place throughout the rest of this year and into next year.
Great. Awesome. Well, thank you so much for all the work that you're doing and for everything that the society is doing. And thank you for sharing a little bit about that with us today. We really appreciate your time and we know you're busy, so we'll let you get back to the patients and everything else that you have to do. But thank you again for your time. And thank you also so much to our listeners. Please tune in again next time and please check out the information about the society in the description below the video.
Thanks for having me, Erin.
Thank
Bye-bye.
you.